Imagine your brain as a superhighway system, always directing traffic to every part of your body. When there is a sudden blockage or a leak in the system, it is like a major road closure. The impact of this closure and how quickly it is resolved depends a lot on where it happens. The exact location of a stroke in the brain plays an absolutely crucial role in determining the immediate treatment, potential recovery, and long-term effects. Different areas of the brain control different functions, so where the damage occurs directly influences which abilities are impacted and what medical strategies are most effective. Understanding the specific brain region affected is paramount for several reasons. First, the brain is highly specialized. For example, a stroke in the left hemisphere might affect speech and language processing, while a stroke on the right side could impact spatial awareness or attention. Second, the type of blood vessel involved, whether it is a large vessel or a small, deep one, guides the urgency and specific interventions. Strokes in large vessels, often seen in the middle cerebral artery or basilar artery, typically cause more widespread and severe damage due to the extensive brain tissue they supply. These often requiring more aggressive treatments like mechanical thrombectomy. Third, some brain areas are more critical for vital functions, such as the brain stem, which controls breathing and heart rate. A stroke in this area can be immediately life-threatening. Knowing the precise location allows doctors to predict potential complications, tailor rehabilitation plans, and anticipate the specific challenges a person might face. This understanding also helps to quickly rule out other conditions that might mimic stroke symptoms, ensuring the right treatment is given without delay. When someone arrives at the hospital with suspected stroke symptoms, medical teams immediately use imaging techniques like a computed tomography scan, or CT scan, or a magnetic resonance imaging scan, or MRI scan, to pinpoint the stroke's exact location. This imaging not only confirms the stroke but also reveals whether it is an ischemic stroke, caused by a clot, or a hemorrhagic stroke, caused by bleeding. The location guides decisions on clot-busting medications such as tissue plasminogen activator, or TPA, or procedures to remove clots. It also informs decisions on managing blood pressure and swelling specific to that brain region. Doctors often talk about the penumbra, which is the area of brain tissue around the core stroke region that is at risk but not yet irreversibly damaged. The location helps identify this penumbra, which is a key target for preserving brain function. Rapid intervention aims to salvage this vulnerable tissue. Another important aspect is understanding collateral circulation. This refers to alternative blood flow pathways that can sometimes supply blood to areas affected by a stroke. The brain's intricate network of vessels means that in some locations, natural bypasses might provide a degree of protection, while in others, the lack of such pathways makes the area extremely vulnerable. Ultimately, the location of a stroke is like a precise diagnostic map for medical professionals. It unlocks a wealth of information, guiding immediate treatment choices, forecasting potential impairments, and shaping the entire recovery journey. Recognizing where the brain damage has occurred allows healthcare providers to implement targeted and effective strategies, significantly impacting a person's chances of regaining function and improving their overall quality of life after a stroke.